morning. Welcome to another Ministry of Health virtual media conference on the national COVID-19 response. Today we have with us the Honorable Terence Deyalsingh, Minister of Health, Dr. Abdul Hamid, General Manager Primary Healthcare for the North Central Regional Health Authority, and Dr. Chad Bisemba, endocrinologist and COVID-19 consultant. I'm Candice Alcantara, Manager Corporate Communication at the Ministry of Health, your moderator for this morning's media conference. We begin with the clinical update and an opening statement from the Minister of Health.
Thank you very much, Candice. Good morning to Dr. Bisemba, who is new to our press conferences. Welcome. Thank you for coming. Good morning to Dr. Hamid, who has been here before. Today's clinical update number 910, as of the 16th of November 2021. Total persons tested to date at both public and private facilities, 424,627. Total new positive cases reported in the last 24 hours, 414. Total positive cases from 12 March 2020 to yesterday, 63,084. Total patients recovered, 54,028. Our total active cases that we are managing now, 7,171. Total deaths, 1,885, and we continue and with all sincerity express our deepest condolences to all the families and loved ones of these deceased. It is really heart-wrenching every day to talk about these figures. Total patients in step-down facilities, 89. Total patients in state quarantine facilities, 95. Total persons in home isolation, 6,207. I will now give the vaccination update, which is not on that. That update 910 was at 4 p.m. yesterday. I will give you the update as of last night, close of play. Total number of first dose of a two-dose regime, and which also includes the Johnson & Johnson, 634,603. No, sorry. Total persons vaccinated with a first dose of a two-dose regime, 634,603, which represents 45.3% of the population. Total persons with a completed vaccine regime, whether it's a two-dose or a one-dose, is 630,781, which is 45.1% of the population. And total number of persons accessing their additional primary doses, 6,639. You will observe that I left out the data on total patients in hospital. For that, I will now ask that the slide which I asked for be put up, where I will discuss that in some detail. So could I have the slide, please? Thank you very much. So this slide shows how hospital occupancy has been progressing since May, 15th of May, when the state of emergency has been declared. So we started and we peaked at 472 by around the 23rd of May. It started to go down, and then we noticed the second vertical line, which represents a date of around 10th to the 12th of July. Our occupancy was 40%, and cases in the parallel healthcare system had dropped from 472 to 318. We then had a plateau for about 113 days, that long gap between the second vertical line and the third vertical line. And we came to the population on the 29th of September, telling the population we have observed a data point at that time. It was not a trend. And we noticed a slight uptick on the 29th of September. And we advised the country on the 29th of September that we are hoping that this is not going to be a trend, that we could continue with the plateau. However, 59 days have passed, and today we are at 473 persons in the public healthcare system. In other words, we are back to where we were in May. We were at 472 by the end of May. We plateaued, we came down to under 300s, which was good, which was manageable. On the 29th of September, we advised the population, look, work with us, the 3 Ws and vaccinations to keep this down, which will be a very good thing, because we didn't want that data point to turn into a trend. As you can see, from around the 14th of October, the upward trend started, it accelerated, and today, 59 days later, we have 473 persons back to our original level in May in the parallel healthcare system. So it is something that we had advised the population to work with us. However, the figures represent a place where we did not want to be, but we are there. So, Candice, I want to thank you for the opportunity to give the clinical update and to explain the hospital numbers. Thank you very much.
Thank you, Minister. And we go now to a presentation from Dr. Bisemba on diabetes and COVID-19 and some of the trends at the ICU in the Couva Hospital and multi-training facility.
Okay. Thank you, Candice. The Honourable Minister of Health, Mr. Terence Dialsing, members of the media and members of the listening and viewing public. So I wanted to speak today about diabetes and its relationship with COVID-19. Why is this important? Well, November is Diabetes Awareness Month, and we recently celebrated World Diabetes Day on Sunday. So in Trinidad, about 13% of our population are diabetic. So there are lots of questions surrounding COVID-19 and diabetes, and I wanted to address some of those today. So the first question I would say, does diabetes put you more at risk of COVID-19 infection? So at the moment, there is not enough data to suggest that it does cause COVID-19 or put you at risk, but we do know for a fact that the risk of severe infection is more when you have diabetes. So according to the trends in ICU, I do refer many patients to the ICU daily, and a lot of them are uncontrolled diabetic patients. We have seen many patients going to the HDUs and ICUs and even requiring intravenous insulin for control of their diabetes. So therefore, I would say, if your diabetes is well managed, however, the less likelihood, the severity of the COVID-19 infection. Another question that I get quite a lot from patients is, does COVID-19 cause diabetes? So I would say we don't have enough data to suggest that right now, but we do know that COVID-19 can cause insulin resistance and is now reported to affect the pancreas itself that produces insulin. Certain medication that we use for COVID-19 infections includes steroids, and this can also cause high blood glucose levels. So in the parallel healthcare system, what we are trying to do is that all patients who are admitted and who have a high blood glucose level, we are screening for diabetes. Many of these patients are asymptomatic and do not know that they have diabetes until they come into hospital to get checked. One of the more important questions I wanted to address is around vaccinations. So are vaccines safe and effective for patients who are diabetic? So all current vaccines that are authorized are safe and effective for diabetic patients. Certainly when you have a vaccine, you build up antibodies and then your body learns to fight off these viruses. So in the following day or two following a vaccine, you may have some mild side effects, including a high blood sugar level. So it's always advisable that you monitor your blood glucose levels up to 48 hours following your vaccinations. Remember, vaccinations, they prevent severe infection, they prevent hospitalization, and most importantly, they prevent death from COVID-19. So I would urge everyone in the public, diabetic patients or otherwise, please go get your vaccines. And what would I recommend to a diabetic patient who does not have COVID-19, and how could they prevent getting COVID-19? So I would certainly recommend following all protocols and regulations that are advised by the Ministry of Health. These include regular hand washing, wearing masks, staying home if you are ill, and socially distancing. You should ensure that you take all your medications that are recommended by your healthcare provider unless told otherwise. You should ensure that you have at least 1 month's supply of your medication just in case you have to enter a quarantine period. I would certainly recommend that you always have access to a healthcare provider if you have any questions about your diabetes. And last but not least, if you aren't vaccinated, please do get vaccinated. Our diabetic patients are at risk, and they are many of them are going to the ICU, and I see this on a daily basis. And I would certainly say, our team is working as hard as we can, but we are struggling. And do the right thing. Get your vaccine to protect yourself, your family, your friends, your co-workers. And we all do. We look forward to building this vaccination program and controlling diabetes as well. Very important. So we are here to help. Please don't hesitate to come to us for assistance. So thank you all for your attentiveness, and I'll be happy to answer any further questions about diabetes and COVID-19 afterwards.
Thank you, Dr. Bisemba. And next we go to Dr. Hamid, who will provide a wider perspective on some of the observations as it relates to COVID-19.
Okay, thank you, Ms. Alcantara. Good morning, Honorable Minister of Health, Dr. Bisemba, and viewing and listening audience of Trinidad and Tobago. So today I'd like to bring an update from the ground levels. What we have been noticing in the last few weeks, we have patients coming in much sicker than before, literally deteriorating in minutes. These scenes are playing out across our country. Previously, the majority of patients presenting were mild to moderate illness. Now, critically ill patients are presenting requiring immediate intervention, such as intubation, in addition to trauma and other medical emergencies. One common theme: most ICU-HDU patients are unvaccinated. On some days, it's 100% unvaccinated cases on the floors of our emergency departments. In hospitals, there are 92%, there are over 93% of the total number of patients unvaccinated, while an even higher number are in ICU and HDU. Our healthcare workers are literally at the breaking point, but we continue to be resilient. We have instances where every 15 minutes there is a crash or collapse of a patient. The mental and physical strain on our staff is absolutely unprecedented. This can be halted in its tracks. We are asking the public, for your own sake, for your family's sake, and the public's sake, to get vaccinated and obey the public health guidelines. We cannot go back to normal if the health care system is under this intense pressure. And we cannot hope that everyone around us is doing the right thing. Let's be our brother's keeper and do our part to ensure people get vaccinated and follow the public health regulations. We are now at a point where it's not business as usual. We have the answers in front of us. Make the choice and get vaccinated. It's our only hope. Do not wait. It will be too late. Get vaccinated. Observe the public health measures. Wear a mask, wash your hands, and watch your distance. Do not reach the point of regret. Do not wait until you are too ill to contact the healthcare system. And we are continuing to notice that persons decline ambulance transfers to A&E and parallel healthcare system, even though they are very, very ill and require hospitalization. These patients often end up within 2 to 3 days in severe critical conditions. The common story for recovered patients is that they wished they were vaccinated. Do not wait to have regrets. Please continue to observe the public health guidelines and get vaccinated. At this point, we do need to pause and highlight the extraordinary job all our healthcare workers are doing. From the nurses, the doctors, the attendants, the cleaners, the lab staff, the maintenance, all working tirelessly day in and day out, leading up to almost 2 years already. They are doing an incredible job in the face of a potential never-ending war. They're functioning under extraordinary conditions without giving up. They are the Navy SEALs of our nation, Trinidad and Tobago. Do not wait. It will be too late. Get vaccinated, observe the public health measures, and do not reach the point of regret. Thank you very much.
Thank you very much, Dr. Hamid. And we go now into the question and answer segment. Members of the media, please state your name, the name of the media house that you represent before posing a maximum of 2 brief questions at this time. We ask that you ask both questions at the same time. And if we have additional time, we will come back to you. We begin this morning with questions from Power 102.
Good morning, Sparkle McIntosh, Power 102 Digital. Both of my questions are for Minister Dialsingh. Minister, there is a question from a member of the public who has concerns as it relates to the topic of vaccinations. Given the increasing number of COVID-19 cases, would the government consider implementing the use of rapid antigen testing at vaccination sites as somewhat of a first step in the process of becoming immunized? And secondly, France has taken a position that persons over the age of 65 would not be considered as fully vaccinated unless they have received the 3rd shot or dose of a COVID-19 vaccine. What is your take on this?
Thank you. Thank you very much, Sparkle. So the government has been following the rapid antigen protocols in the public healthcare system. To date, we have done, I will try to get the figure for you, many tens of thousands. At this point in time, we are not looking to roll it out at the mass vac sites. On the issue of France being over 65, individual countries, as we always say, they are sovereign. They can make their own decisions and own determinations. We have decided, based on WHO's recommendations, that once you complete 2 doses of a 2-dose regime or 1 dose of a 1-dose regime, you are considered fully vaccinated. So that is the Trinidad and Tobago position as another sovereign state. Thank you very much.
Thank you. Let's go now to Newsday, please.
Hi, good day. Tyrell Gittins from the Trinidad and Tobago Newsday. Both of my questions are directed to Minister Dialsingh. The first question is, some people on social media are saying that the Ministry of Health have hired a company who are calling them to get data on everyone who has been vaccinated. Can you confirm if this is potentially to implement a vaccine passport or create a center?
Clearly, can you speak a little louder and slower so we can hear everything? There's a little technical issue with your mic, I guess.
Okay, sure thing. Are you hearing me better now?
Just a bit, go ahead.
All right, great. Sorry about that. I apologize. Both of my questions are directed to Minister Dialsingh. So there are some people on social media who are saying that the Ministry of Health has hired a company who have been calling them just to get information. This is vaccinated people. So is this being done to create any central, database?
Right, okay.
Vaccine passport, and the strict concerned that there will be a spike of COVID-19 cases in Tobago after the events that we would have seen during nomination day on Monday.
Okay, thanks a lot for your 2 questions. So we have addressed that issue of phone calls going out several times, and I'm glad to readdress it. Yes, the Ministry of Health, in an attempt to digitize our vaccine records, which will ultimately lead to an electronic copy of your vaccine record on your phone with the necessary QR code, is calling people to verify information, especially when you come across errors on the actual physical forms. So that is correct, and we have been doing that and saying that now about 2 months now. On the issue of a spike in Tobago, We are always concerned at the Ministry of Health of any congregation where the public health measures are not adhered to. So we simply ask the public, post tonight, when the SOE comes to an end, a lot of the responsibility in managing these hospital numbers, which I indicated at the start, in bringing them down, is going to rest with the population. As the Honorable Prime Minister indicated, the days for harsh lockdowns are basically over. The government cannot continue to stifle the economy and have a collapsed economy, which will lead to all sorts of other problems. So a lot of the onus, a lot of responsibility shifted to the population at the start of the SOE to encourage people to get vaccinated. Now that we have hit this place where vaccines are only being done at a rate of 1,200 a day, in addition to vaccinations, the population has to go back and we have to re-emphasize the 3 Ws. If we are to control and manage this spike, especially in the light of a low vaccination rate. If you would recall, in early March, without vaccines, we had a rolling 7-day average of 3 per day. It's now 488. And we did that back in March by observing the 3 Ws. What are they? Washing your hands, wearing your mask, and watching your distance. No congregation. And any season, whether it's a political season, Christmas season, a time of celebration, is a cause for concern. Thank you very much.
Thank you very much, Minister. Now to ACP News, please.
Good morning. Priya Bihari, ACPnews.com. My 2 questions are for Minister Dayal Singh. Minister, good morning.
Good morning.
My first one, the residents of Valsin are complaining about a place on Mayfield Road where there seems to be a breach of the COVID-19 regulations where there are parties. There have been several calls to the police and it has all gone in vain, and they wanted you to intervene as both the Minister of Health and the MP for the area. So I don't know if you know anything about that.
Sure.
One. Secondly, you just spoke about, today that the SOE is going to be lifted and therefore we wouldn't have any curfew. To what extent now the ministry is going to use the public health regulations to sort of replace the curfew in terms of trying to stop gatherings and to stop the spread of the Delta variant now?
Thank you. So I'll take both questions. So the issue of the house in Valsin is one I raised publicly before. I facilitated a meeting with residents plus the then Commissioner of Police, Gary Griffith, earlier this year or late last year to find a resolution. About 2 months ago, I facilitated another meeting at the home of one of the members of the Jamboree Park where I live, and this house is not far from me, and I am disturbed by it, with the inspector from the St. Joseph Police Station and officials from the Northeastern Division to once again tackle the behavior of the owner of this house in Valsin. More recently, I have been in contact with both Inspector Alexander and Deputy Commissioner of Police MacDonald Jacob on the matter. I have done everything and more as the Member of Parliament for the area. The owner of the property thumbs his nose at authority, and I have communicated not on a daily basis, but as frequently as possible to the then Commissioner of Police, Gary Griffith. I arranged for 3 persons to meet with him, again, at the homes with the St. Joseph Police Station on Northeastern Division, and more recently with Inspector Alexander and Deputy Commissioner of Police, MacDonald Jacob. I have even suggested to the homeowners that we take legal action And I am prepared to help financially with taking legal action. So that is all I have been doing very quietly behind the scenes. On the issue of the public health regulations, the new public health regulations will come out tonight, as they normally do, and the public will be advised. Right? So in this time, we keep emphasizing that individual responsibility becomes even more crucial, as we did back in March when we had a rolling day average of 3. Thank you very much, Prior.
Thank you very much. And just a reminder to members of the media that Dr. Bisemba and Dr. Hamid are here with us as well. We go to TV6, please.
Hello, good morning. Vanessa Cutting, TV6 News. Both of my questions are for Minister Dayal Singh. With public pools to be designated safe zones, could you give us some guidelines where it concerns mask wearing in the vicinity of the pools, and also how many persons would be allowed at or in the pool at any given time? And also, considering that, of course, we have more rollbacks on the economy, we're opening up more, we have more spread, we have the Delta variant. At any time, has the ministry been considering reverting to mandatory state quarantine for confirmed COVID patients as opposed to home isolation? Thank you.
Thank you for both questions. So on the question of pools and numbers, I can advise again. Today is Wednesday. The new regulations will come out tonight. So let's wait and see. The Honorable Acting Attorney General is drafting the new regulations, which I will sign off on later today after we get Cabinet approval. On the issue of mandatory state quarantine, that is no longer a possibility anywhere in the world where you have large numbers of cases. So, for example, we have 7,171 total active positive cases. The question arises, where are we going to find 7,171 rooms, homes, houses, apartments to house these people? So, around the world, mandatory state quarantine is not something that is practical when you have this level of spread. It is practical only when you have very small numbers, as we did in the early days, grappling with this issue. Thank you very much.
Thank you. And now we go to a follow-up question from AZP News, please. AZP News, are you with us? We're ready for your question.
Yes. Good morning, Prior Bihari, AZP News. You hear me right? You hear me now?
Yes, we can. Thank you.
Yeah. Minister, I know there seems to be a constant issue with schools, teachers and students, are going in quarantine. A lot of people are concerned that there are about pupils and teachers who are not vaccinated in schools. Is that a concern for the ministry? And would you rather have teachers and students in school who are fully vaccinated?
Thank you,
rather than those who are not?
Thank you. Thank you, Prior. So the issue of schools' vaccination policy is one for the Ministry of Education. The Ministry of Education has taken a decision, which I have said publicly, I fully support, because we need to get our children back out into society, because at-home learning does not contribute to their overall development. So that is the position. On the issue of vaccination in schools, we support vaccinations of everyone who is vaccinatable. So the vaccinatable population in Trinidad and Tobago is roughly 1 million adults over 18 and another 100,000 persons between 12 and 18. When you look at that, and you only have 630,000, you're just about 50% of the vaccinatable population. That is simply not good enough. And all sectors of society, whether it's education, national security, health, all sectors of society now have a role to play in how this country navigates the waters going forward by doing 4 things: washing your hands, wearing your mask, social distancing, and being vaccinated. Thank you very much, Prior.
Thank you very much. Now we have a follow-up question from Newsday, please.
Hi, good day, Minister Dialsing. We continue to hear about the heartbreaking experiences of healthcare workers on the front line of the COVID-19
Sorry, we're
fight.
not hearing you clearly. Can you repeat a little louder?
All right, sure thing. We continue to hear about the heartbreaking experiences of healthcare workers on the front line of the COVID-19 fight. Are free counseling services being provided to these healthcare workers?
Yes, thank you very much for that question. So don't take it from me that free counseling services are being provided. You have Dr. Bisamba here, you have Dr. Hamid here, and you had the testimony of Nurse Josette Smith Bethel, who was here, lauding the type of psychosocial, mental support that they get, which is absolutely free of charge. And let me just say, even before COVID, every ministry in this country has something called an EAP program, Employee Assistance Program, where any employee, even before COVID, who felt that they needed that type of psychological or mental support, had it free of charge. But for the COVID response, it was stepped up significantly. And I was speaking to one of the nurses, the general manager of nursing at North Central RHA yesterday, and she used a very interesting term to describe what they are doing now. Because healthcare workers are so traumatized, and I would like Dr. Bisamba to come in afterwards, they are so traumatized by what is now being termed unnecessary death and pain, not only on behalf of the patients, but on behalf of these caregivers who have to deal with this on a daily basis. The general manager of nursing at North Central RHA, Nurse Hinney, said yesterday they have introduced something called now mental detoxification. You hear that term? In the old days, 2 or 3 months ago, detoxification was if you had a poison in the system or you drank Bromoxone or something like that. Now they are talking about mental detoxification. But let's not put a plaster over the sore. The ministry can put all the resources forward to help these patients through, to help these workers through this time. However, mental scars do not heal like physical scars. Mental scars stay with these healthcare workers. And the population could help us. Again, and I am going to sound like a stock record this morning, by the 3 W's. Vaccinate and don't stay home. You heard Dr. Hamid again this morning. We had 3 people who demised this week who only came into the public health sector on the 3rd visit of the ambulance. They refused it at the 1st visit. They refused it at the 2nd visit. It's only at the 3rd visit they agreed to come in. And as both doctors will tell you, by that time it is too late. So one of the ways that we could help our healthcare workers is the 3 W's, the vaccinations, and come into our system early so you can get ward level care, have a better chance of going home for Christmas, rather than presenting so late after the ambulance comes to you 3 times, and then presenting, you go straight into an ICU setting, an emergency setting, where your chances of survival are little less. Dr. Bisamba, you want to come in, please?
Thanks, Minister. So I completely agree. So the team right now at the hospitals, they are under a lot of duress. You know, we've been working tirelessly since February 2020. Not only doctors, you know, but nurses, cleaners, janitors, lab staff, everyone since February 2020, and everyone is a bit drained. We do have good support from our mental health teams, and they reach out to us every week. We have a lot of junior doctors as well that are managing patients with COVID-19. And as you could imagine, it's a brand new experience to them and a very overwhelming experience. So I agree with Minister, you know, we follow the 3 W's, you know. washing your hands regularly, wearing your mask, and watching your distance. And again, I do urge everyone, diabetic or not, please get vaccinated. It will help the country so much. Thank you.
Thank you. Let's go now to TTT, please.
Good morning, everyone. I want to ask, in terms of the end of the state of emergency, I saw in the papers today that there were some loopholes. In other words, people leave the hospital and they're supposed to go into quarantine, and yet because they have no documentation, the police can't do anything. If they come and they meet them and say, look, I have nothing to show that and they have nothing to show that the person is supposed to be in quarantine. So I'm hoping, and could you tell us if that is going to be addressed in the new regulations that are being drafted? And my second question would be, in terms of diabetes, this is to Dr. Bisambar. Is there also, I know that this month is the month of where we're looking at diabetes, but do all the things that you warned about affect other lifestyle diseases as well, such as high blood pressure and heart problems, etc.? And in that light, how do you suggest that people with the lifestyle diseases deal with their fears of perhaps getting blood clots or other side effects, which may happen with the vaccine? How are they going to deal with that fear? Because I think it's that fear that is keeping them from becoming vaccinated. Thank you.
Thank you very much. So I will take the first question about documentation. The Chief Medical Officer chairs what is called an interministerial committee, where you have representatives of TTPS, National Security, ODPM, local government, and so on. So I did raise this issue with him, and the article was a very accurate representation, and DCP Williams, who is the point person, is aware of the situation, and we are working together with the Chief Medical Officer and his county medical officers of health to see how we could solve this issue. However, in the interim, we ask people to employ a high degree of personal responsibility. If you know you are COVID positive, please stay home and isolate. Do not necessarily wait for an order, a piece of paper, the police to contact you, or the CMOH. It's cliched now, but we are all in this together. We are our brother's keeper in this, but we are working on it from a regulation, law enforcement side, but we also ask the persons who are in this position to work with us and isolate and quarantine yourselves. Dr. Bisambar.
Thanks, Minister. So just moving on to the second question. So patients who aren't diabetic but who suffer from high blood pressure, cardiac disease, or even kidney disease, they are all at higher risk of severe COVID infection, I would say. And the regulations and protocols certainly would apply to them as well. In terms of vaccinations, if there are any questions of whether a patient is fit to have a vaccine, I would say speaking to their specialist or healthcare provider is certainly recommended. And I know people are a bit hesitant, and maybe the minister may be able to elaborate a bit on vaccination hesitancy.
Yeah, thank you. So the issue of vaccine hesitancy is one that is plaguing countries around the world, near and far. There's a very good study on CARPHA's website about vaccine hesitancy in the CARICOM region. What best practice around the world is saying about vaccine hesitancy and how to reach these people, even though we are reaching them now in numbers of 1,200 a day, which is relatively small, is that we have to respect their views. We have to acknowledge that in their minds, what they believe is real to them. But we must continue to give them the information in a way that is non-threatening to them, that does not, how to put it, does not make them feel as if they are being unreasonable. Whatever the source of their fears, we have to acknowledge it as real. We continue to respect their perspective, but at the same time, we have to lead them to a place where they can make an informed decision based on evidence and based on science that the vaccines are safe. It is safe for them. It will help us and help you not infect your loved ones, your aged persons at home. And to date in Trinidad and Tobago, we have delivered about 1.2 million shots, both first dose, second doses. In that, we have had less than 10 adverse events, less than 10. But look at how many deaths we have had amongst the unvaccinated. 97% of the deaths, hundreds of deaths, 8 and 10 deaths per day are among the unvaccinated. So we continue to give them the information. I see it said that the ministry should be doing more, going out to people. We have been doing that. We have been in communities, Sans Souci, Bitham, Bangladesh in my constituency, South Trinidad, Princestown, all over the place. We have been in malls, car parks, supermarkets, and we are starting another initiative next week at major shopping centers. Look out for that. We were invited by the Port Authority 2 weeks ago. We went down to the Port Authority. We spent the entire day at the Port Authority, and we welcomed the opportunity. And at the end of the day, talking to persons one-on-one, we got 7 persons vaccinated. I leave that for you to decide whether that is a good return or not, but at least 7 people are safer now. We have been to organizations, we have been to churches, mosques, mandirs, we have partnered with NGOs, we have freed up the channels of distributions via about 100 sentinel physicians. So all these are sources of rich information to help the individual and their families make an informed decision. The current thinking that I'm seeing, and I tend to agree with it, that the best way to encourage people to get vaccinated is for someone in their social circle who has been vaccinated, like a friend, a mother, an aunt, to talk to people now to get vaccinated. So if we could get these people to be spokespersons within their social circles, within their work environment. So I have been vaccinated. I'm encouraging you to get vaccinated. That's where a lot of the communication is now going. You know, bring a friend, bring somebody to get vaccinated. So we continue with the 3 W's, and we ask people not only for their own safety, but for safety of your loved ones, your children, your elderly parents, your co-workers, that the vaccines are safe. Globally, over about 7.3 billion doses of vaccines have been given out. But yet every day in Trinidad and Tobago, 8, 9, 10 people die of COVID-19. Where the risks as minimal as they are, but where the benefits as great as they are, and make a decision to get vaccinated. Thank you for the question.
Thank you. And a follow-up question from TV6, please.
Hi, I'd like to ask for a little leeway for follow-up questions. I think we have some time. The issue at Jamboree Park, I'm aware that it has been going on for at least a year now. What exactly is the issue, the challenge to enforcement here? Because we do have the regulations and the persons can be charged and these types of things. So what action, if any, has been taken? And if no action, then why not? And you mentioned that we have less than 10 adverse events due to vaccines. The last time I checked, or that the information was given that I am aware of, it was 5. So if you could just tell us what is the exact number and what exactly were these events? And my final question is...
I think that's it. As much as we'll take at this point, Ms. Cutting, we can always come back.
So I gave a detailed explanation of what I have done as a Member of Parliament for Jamboree Park. It is now up to the TTPS. So let me repeat. I facilitated a meeting between 3 members of the Jamboree Park Association and then Commissioner of Police Gary Griffith. As a member of Parliament, I did that. I facilitated meetings, again, with the St. Joseph Police Station and the Northeastern Division with the Jamboree Park personnel. I was present at that. Subsequently, I brought the matter to the attention of Inspector Alexander and Deputy Commissioner of Police MacDonald Jacob. It is for law enforcement to attend to the situation. I also said I was willing to support the association financially to retain a lawyer to do the necessary legal action. I have been working on this with the residents and with the TTPS for over a year. On the issue of adverse events, so less than 10 is about 5. So a couple of them were in the early days with blood clots. There was one, I believe, with myocarditis, and a couple others. The CMO is really the authority on that. But in 1.2 million doses of vaccines in Trinidad and Tobago, less than 10 adverse events. However, and this is since the program started in February. So from February to now, 1.2 million doses of vaccine. So we have to contextualize it, because what we tend to do is focus on the negative and forget the positive. So from February 17th to now, we have administered 1.2 million shots. Of that, less than 10 known adverse events. However, we have had hundreds and hundreds of deaths, with Saturday alone being 22. So, yes, we need to talk about adverse events. It's here. But the benefits of vaccination is here. And if we don't vaccinate more and more persons, we are going to be in a very dark place sooner rather than later. Thank you very much, Renessa.
Thank you. Radio Tambourine, please.
Hi, good morning. Clayton Clark, Radio Tambourine. Minister, I just want to get your views on statements reportedly attributed to the president of the Nurses Association that the parallel health system is or venues, facilities are manned by inexperienced nurses, and that there's an exodus of nurses, for whatever reason, they're leaving the country. So your thoughts on that? And secondly, the state of emergency is to end today, and well, of course, we have campaigning in Tobago. Is the ministry in any sort of discussions with the TRHA and the Division of Health in the Tobago House of Assembly with regards to any special measures or advisory or caution as the campaign picks up leading up to the December 6th THA elections? Thank you.
Thank you. So let's start. The issue of inexperienced health personnel is not an accurate reflection of what is going on. We have over 100 RNs, registered nurses, manning the ICU and HDU facility at Couva. Yes, when nurses come in to do their practicum, their training, you will have a mix now of experience and persons doing their practicum on the job. But to make a statement that you attribute to someone else, that it is being manned solely by inexperienced personnel, is not true. It is something I answered a question on in the Senate yesterday. The issue of exodus of nurses, again, there is always what you call natural attrition, where some people, nurses and doctors, go abroad, retire, resign. In the cases of nurses, some go on maternity leave and so on. There is always a turnover. And again, I answered this question in the Parliament a few months ago. At this point in time, there is no exodus of nurses. There has always been, throughout the years, a natural turnover for various reasons. Yes, migration is one. 2, leave, maternity leave especially. 3, you might find some nurses move from one RHA to another, which is misconstrued as being an exodus. So I hope that answers that. On the other one about measures in Tobago, the measures that are in place are for Trinidad and Tobago. So, and it is up to the TTPS in Tobago to police and implement the measures. Okay? Clayton, thank you for your questions, my friend.
Thank you. And AZP now, please. AZP News.
Good morning again, Minister. I just want to get your take on a new drug by Pfizer, the oral antiviral drug. You know, if Trinidad and Tobago would be part of that, would we get that soon to treat with COVID-19 patients? Thank you.
So, as we answered a question on this in the Parliament on Friday, we are in talks and have been in talks very proactively with Pfizer on this drug. Pfizer has to send a non-disclosure agreement for us to sign, and because we are committed to signing a non-disclosure agreement, there is nothing I must see in the public domain that will spook Pfizer for Pfizer to think we are not a country or a ministry that they could deal with according to the terms of the non-disclosure agreement. But we have been having talks with Pfizer for a while now, and if and when the drug is available to us, we will look at it.
Thank you very much. And TV6, we're ready for you again.
Hello?
Yes, we can hear you. Yes.
The Chamber of Industry and Commerce is calling for government to implement measures that will ensure that unvaccinated persons get vaccinated, a lot more unvaccinated persons, and they're suggesting that government expand safe zones to include any area where there are a lot of persons gathered, particularly in close proximity to each other, such as public transportation. As the Minister of Health, what do you make of this suggestion, and is government currently considering anything like this at this point?
Thank you, Renessa. So I think public transportation is currently at 75%. As the new initiatives under the Safe Zone policy, that will be a discussion to be announced by the Honorable Prime Minister when he looks at all the data available as Minister of Health. I do not make those decisions on a press conference. That is not within my remit. But we look at all suggestions. All suggestions are welcome. We are in this together. And the Chamber of Commerce has been an important partner, a reliable partner, and a very good partner in the fight against COVID-19. So we thank them for their suggestion.
Thank you very much. And TTT, we have an additional question from you.
Yes, once again, good morning. And we have been having reports of the police not accepting the digital proof of vaccination in safe zones. At least 2 people have run up against the police in that respect. And we're wondering, what is the policy? Is the digital thing acceptable, or they're saying they need the original vaccination certificate? Thank you.
Thank you. So again, through the Chief Medical Officer and the Interministerial Committee, where DCP Williams is a member, we have indicated to the TTPS that we will accept phone shots or digital records as proof of vaccination. So it is something I asked the CMO to remind his counterpart at the TTPS very often, so it can be drilled down to all the divisions. Thank you.
Thank you very much, everyone. As we have no more questions from the media, we have come to the end of today's media conference. Please remember that we are in the midst of a serious battle to protect yourself and your loved ones from COVID-19 vaccine. Please remember the 3 W's: wash your hands or sanitize, watch your distance, wear your mask, and of course, be vaccinated. Thank you very much.
The Hot Zone.
My name is Dexter Saunders, and we're here at the Covert Hospital. We're actually on the floor of ICU HDU. We'd really prefer not to ever see you guys here. We'd prefer to see you guys on the outside, getting vaccinated, because here is serious business. people die here. It's not easy. Seeing and hearing mothers crying, fathers crying, even some of my colleagues. They call us the frontline workers. This is a wartime term. The war is being fought right here. And the only weapon we have in this war is vaccination.
Don't delay. Get vaccinated today.